Hernia. This presentation describes definition, sites, and types, etiology, parts of hernia and classifications of hernia. This is very important topic for medical students. So, let's start. Hernia means. Hernia means, to bud or to protrude, offshoot, in Greek, or rupture, in Latin. A hernia is defined as an area of weakness or disruption of the fibromuscular tissues of the body wall. It is an abnormal protrusion of a viscus or a part of a viscus through an opening, artificial or natural, with a sac covering it. 75% of abdominal wall hernias are groin hernias. 15% of males and 5% of females will develop groin hernia. Sites of hernia. Often hernia is also defined as an actual anatomical weakness or defect. For example, epigastric, paraumbilical, umbilical, Spigelian, divarication of recti, inguinal, femoral, obturator, superior lumbar, inferior lumbar, gluteal or sciatic. Inguinal hernias. Inguinal hernias occur when fatty tissue or a part of bowel pokes through into groin at the top of inner thigh. Inguinal hernia is the commonest hernia, 73%, because the muscular anatomy in the inguinal region is weak and also due to the presence of natural weakness like deep ring and cord structures. It mainly affects men. It's often associated with aging and repeated strain on the abdomen. Femoral hernias. Femoral hernias also occur when fatty tissue or a part of bowel pokes through into groin at the top of inner thigh. They're much less common than inguinal hernias and tend to affect more women than men. Like inguinal hernias, femoral hernias are also associated with aging and repeated strain on the abdomen. Umbilical hernias. Umbilical hernias occur when fatty tissue or a part of bowel pokes through abdomen near belly button, navel. This type of hernia can occur in babies if the opening in the abdomen through which the umbilical cord passes doesn't seal properly after birth. Adults can also be affected, possibly as a result of repeated strain on the abdomen. Hiatus hernias. Hiatus hernias occur when part of the stomach pushes up into chest by squeezing through an opening in the diaphragm. This type of hernia may not have any noticeable symptoms, although it can cause heartburn in some people. It's not exactly clear what causes hiatus hernias, but it may be the result of the diaphragm becoming weak with age or pressure on the abdomen. Other types of hernia that can affect the abdomen include epigastric hernias, where fatty tissue pokes through abdomen, between navel and the lower part of breastbone, sternum. A paraumbilical hernia is a protrusion of the abdominal contents, including mesenteric fat or bowel, through a weak point of the muscles or ligaments near the navel. Spigelian hernias, where part of your bowel pokes through abdomen at the side of abdominal muscle, below your navel. Diastasis recti or divarication of recti, also known as abdominal separation, is commonly defined as a gap of roughly 2.7 cm or greater between the two sides of the rectus abdominis muscle. An obturator hernia is a rare type of hernia of the pelvic floor in which pelvic or abdominal contents protrudes through the obturator foramen. Because of differences in anatomy, it is much more common in women, especially multiparous and older women who have recently lost a lot of weight. Lumbar hernias occur through defects in the lumbar muscles or the posterior fascia, below the 12th rib and above the iliac crest. Two types are described, according to the anatomical location of the hernial neck. Superior lumbar hernia, Grenfell-Less shaft hernia, occurs through the superior lumbar triangle, and inferior lumbar hernia, Petit hernia, occurs through the inferior lumbar triangle. Incisional hernias. An incisional hernia is a type of hernia caused by an incompletely healed surgical wound. In general, incisional hernia is next to inguinal hernia. Muscle hernia is defined as a protrusion of the muscle belly through an acquired or congenital facial defect. Constitutional herniation may occur through congenital facial defects, or they may be acquired by means of exertional fatigue. They also occur in leg muscles as the result of a sports injury. Gluteal and sciatic hernia are among the rarest of abdominal hernias. The gluteal hernia passes through the greater sciatic foramen, either above or below the piriformis. The sciatic hernia passes through the lesser sciatic foramen. Etiology of hernias includes straining, lifting of heavy weight, chronic cough, in tuberculosis, chronic bronchitis, bronchial asthma, emphysema, chronic constipation, habitual, rectal stricture. Urinary causes. In old age, BPH, carcinoma prostate. In young age, stricture urethra. In very young age, phimosis, Maydl stenosis. Obesity. Pregnancy and pelvic anatomy, especially in femoral hernia in females. Smoking. Ascites. Appendicectomy through McBurney's incision may injure the ilioinguinal nerve, causing right-sided direct inguinal hernia. An indirect inguinal hernia occurs in a congenital, preformed sac, the remains of processus vaginalis. Chances of presence of bilateral preformed sac is 60%. Familial collagen disorder, prune belly syndrome. Parts of hernia includes covering, sac, and contents. Sac is a diverticulum of peritoneum with mouth, neck, body, and fundus. Neck is narrow in indirect sac but wide in a direct sac. Body of the sac is thin in infants, children, and in indirect sac but is thick in direct and long-standing hernia. Coverings of the sac are the layers of the abdominal wall through which the sac passes. Which are hernia without neck? Those hernias with larger mouth lack neck, for example. Direct hernia, incisional hernia. Which are hernia without sac? Epigastric hernia, it is protrusion of extraperitoneal pad of fat. Contents of sac. Omentum, also called omentocele or epiplocele. Intestine, also called enterocele. Commonly small bowel, but sometimes even large bowel. If a portion of circumference of bowel is the content, it is called Richter's hernia. Urinary bladder may be the content or part of the posterior wall of the sac. It is called as cystocele. Ovary, often with fallopian tube. Meckel's diverticulum, also known as Litra's hernia. Fluid is secreted from congested bowel or omentum. It may be an infected fluid or acidic fluid or blood from the strangulated sac. Hernia can be classified by 1. Direct or direct hernia. 2. Clinical classification. 3. Congenital or acquired classification. 4. Classification based on content of hernia. 5. Classification based on site of hernia. Direct or indirect hernia classification. Inguinal hernia can be classified in direct and indirect hernia based on its relation to inferior epigastric vessels. Indirect hernia protrudes through the inguinal ring and is ultimately the result of the failure of embryonic closure of the processus vaginalis after the testicle passes through it. Lies lateral to inferior epigastric vessels and covered with internal spermatic fascia with congenital or adult onset. Whereas direct inguinal hernia enters through a weak point in the fascia of the abdominal wall, Hesselbach triangle. Lies medial to inferior epigastric vessels and not covered with internal spermatic fascia with only adult onset. Clinical classification. Reducible hernia, hernia gets reduced on its own or by the patient or by the surgeon. Intestine reduces with gurgling and it is difficult to reduce the first portion. Omentum is doughy, and it is difficult to reduce the last portion. Expansal impulse on coughing present. Irreducible hernia, here contents cannot be returned to the abdomen due to narrow neck, adhesions, overcrowding. Irreducibility predisposes to strangulation. Obstructed hernia, it is an irreducible hernia with obstruction, but blood supply to the bowel is not interfered. It eventually leads to strangulation. Gary's stricture, constriction that occurs due to ischemic narrowing of small bowel which has reduced from an obstructed hernia. Inflamed hernia, it is due to inflammation of the contents of the sac, e.g. appendicitis, salpingitis. Here hernia is tender but not tense, overlying skin is red and edematous. Strangulated hernia. It is an irreversible hernia with obstruction to blood flow. The swelling is tense, tender, with no impulse on coughing and with features of intestinal obstruction. Features of intestinal obstruction may be absent. Congenital and acquired classification. Hernias can also be classified by when they occur. A person may be born with a hernia, or a hernia may be acquired from daily activity. Acquired hernias are caused by the wear and tear of living, such as childbirth, weight gain, and other muscle strain. Congenital hernias are present from birth and happen at points of weakness in the abdominal wall. Children's hernias are almost always congenital. Classification according to the contents. Omentocele contains omentum. Enterocele contains intestine. Cystocele contains urinary bladder. Littre's hernia contains Meckel's diverticulum. Maydl's hernia. Maydl hernias are defined as the presence of two small bowel loops within a single hernial sac, that is, there are two efferent and two afferent loops of bowel, forming a W shape. This type of hernia is more prone to strangulation and necrosis. Sliding hernia, here posterior wall of the sac is not only formed by the parietal peritoneum, but also by sigmoid colon on left side, cecum on right side and often with portion of the bladder, both sides. Richter's hernia contains part of the bowel wall. Classification based on sites. Inguinal hernia. Femoral hernia. Obturator hernia. Diaphragmatic hernia. Lumbar hernia. Spigelian hernia. Umbilical hernia. Epigastric hernia. Thank you for watching this presentation. Please subscribe to my channel for more such presentations.